Hello everybody. My name is Dr. Srinivas Kandula, practicing endocrinologist at Care Hospitals, Mushirabad. What is the ideal breakfast for a diabetic patient? Well, breakfast, often called as the king's food, should never go skipped in a diabetic patient because most diabetic medication have this risk of causing low sugars, and when taken without adequate breakfast will increase the risk of low blood glucose levels by noon or so. The ideal breakfast for a diabetic patient, especially in the context of South India, is to consume idlis of around 3 to 4 depending on the body weight. An alternative to this is to consume dosas 2 or 3 again depending on the baseline body weight. And the best alternative is to consume rava upma, which is again a good source of fiber and carbs with low fat. So when you couple this breakfast with a fruit or a glass of milk, you are also adding a source of protein in your diet in addition to essential vitamins and minerals that are present in the fruit that you consume. So a fruit coupled with a glass of milk or a coffee without added sugars, and a breakfast consumed in the form of a rava upma, or for the matter idli or dosa, a serving size again depending on the baseline body weight of the patient, can be an ideal breakfast option for most diabetic patients. Also, it's advisable to avoid consuming white bread because it has got a high glycemic index and could again cause poor glucose control, and it's also advisable to avoid breakfasts which have a lot of oil or ghee in the form of puri or chana bhatura, and also many patients have this bad habit of consuming a sweet early in the morning, again coupled with the breakfast, and this also has to be avoided because all this would be an additional source of, or an excessive source of sugar and fats, and could really lead on to overweight or obesity on a long run.